With the health struggles we've been seeing around the globe, more and more people are trying to find ways to strengthen their immune system. Our guest today is Dr. Clayton Koganow, who is a neuropathic doctor in Lethbridge with Well Vitality Health Clinic. He's also done some training in conventional medicine with a Bachelor of Science in Exercise Science, Kinesiology, and doing 3 years of research on radiation and cancer at the University of Lethbridge. So great to have you on once again, Dr. Koganow. Welcome.
Thank you very much. It's great to be here.
Great. Okay, so with all the health challenges that we're seeing these days, it seems that there's a big spike in people who want to build up their immune system in order to stay healthy. Of course, we're seeing this post-COVID. Now it's the new year as well, so people got those resolutions going. So, and
Yeah.
there is also a lot of talk that vitamin D is a good immunity builder. So tell us about vitamin D.
So it's been shown vitamin D, it's a fat soluble vitamin. Our bodies produce it through our skin with sunlight. Most Canadians don't get enough of it. It has an important role in the immune system. Its role actually is not only immunity itself. Most people think that it is only for your mood and immune system, which are big parts. It increases your body's ability to produce, activate white blood cells and different cytokines. So taking it reduces the severity and duration of colds. And so therefore it's good. We also recommend not taking too much of it because what a lot of people don't realize is that its main, probably more so important function is calcium. It actually allows calcium to better be absorbed through your digestive tract and also build bones stronger and healthier. And so you don't want to take too much of it because it could actually increase your internal calcium too much. And over the years, a lot of people have been taking massive doses of it because they see it as boosting their immune system, etc. But now that everyone's kind of on that train of taking it, we also want to heed a little bit of caution with not overdoing it.
Yeah, good advice there. What are some other supplements that are known to build the immunity?
Oh, well, there's a lot of them. Like astragalus can help to increase white blood cell production. N-acetylcysteine is inherently antiviral, as are beta glucans, which come from mushrooms. Vitamin C is a very popular one. I think that the research on that really shows that taking it as a preventative isn't as effective, not really very effective, but taking it when you have a cold is quite effective. And then there's a lot of other supplements, a lot of other herbs out there as well that are equally beneficial for boosting the immune system. Some are antiviral, like garlic is very antiviral, and it's also increases your core temperature to help to kill the viruses as well. And so, yeah, there's a ton of options there that are very safe and very effective.
Okay, yeah. I mean, we've heard about a ton of these herbs that are antiviral in nature, so garlic being one. If we wanted to find out more information of that, can we find it out in your shop there in Well Vitality?
Yeah, you can always book in with any naturopathic doctor. We're very educated in both conventional and alternative medicine to try and just help provide good evidence-based treatments for these things, beyond just taking your regular cold medication. But yeah, it's one of those things where you don't want sometimes just to start taking a bunch of supplements because you don't really know how they're potentially going to interact with your medications, etc.
So, Dr. Koganow, your clinic actually offers ozone therapy. So, maybe tell us about this. What is ozone? What does it do for our health?
So ozone is it's a gas, O3, so it's heavier than oxygen, which is O2. It is it's actually a fantastic treatment. Most people haven't heard of it. It has extremely good research to back it up as well. It itself is antimicrobial, so it is active against both viruses, bacteria, parasites, etc. But it also increases your cytokines, which are chemical signals in your body that fight against and activate when you're sick.
Wow.
So it multiplies your ability to fight against the infection as well as helps to kill the infection at the same time. And it also donates an oxygen into your bloodstream, which can help with energy production and mitochondrial function. So its role is sort of quite complex, but it has excellent research to back it up as an antiviral and just antimicrobial in general for people that are quite chronically ill. It's a wonderful treatment.
Yeah, it sounds like a magical treatment or something.
Yeah, I mean, it seems it's something that most people haven't heard of. Yet it has just an astronomically large amount of research articles proving how effective it can be against viruses. It's quite remarkable, actually, and I encourage patients to always look it up as well.
Yeah, is it more for somebody who's kind of prone to certain illnesses, or like if you're just sick, can you go in and get the therapy done?
Yeah, there's different IVs that we can do for boosting immune systems and helping with that. But definitely, it's something to at least be aware of as a potential treatment option that you could talk to your naturopathic doctor about for
Okay,
sure.
great. Okay, so switching gears here, how much of a role does stress and anxiety play when it comes to our immune system?
It's extremely important. It actually lowers a lot of different white blood cells in your body when you're chronically stressed out. And it also spikes up a hormone in your body, a very important hormone, a stress hormone called cortisol. And your cortisol allows you to handle and deal with stress. And when it's elevated, it severely limits your immune system and your cytokine production. And so stress and anxiety, it's really important to manage that. Otherwise, people will get a lot easier. It's a lot easier to get ill when you're stressed out due to those hormone changes.
Yeah, definitely. I think that's kind of old advice there. Reduce your stress. So, I mean, with that said, what are some things that we can do to reduce stress?
Well, there's a lot of different activities that you can do to reduce stress: yoga, meditation, exercise, etc. But I think, in my practice anyway, what I really like to tell my patients is most people have to take something off of their plate. They're doing too much. People these days, everybody is doing too much. We have too much on the go. We've said yes, and we have to learn to say no. And I think that it's a very important thing, and it's a very difficult thing for a lot of people to, say no to things so that they have better balance in their life. And I think that that's a lot of times where a lot of people's stress are coming from. We can't change and fix all of our stress, but we can definitely help to decrease it by just sort of stepping back and looking at things and, creating a better balance.
Yeah, I wish there was that magic pill that we could just take and all our stress is eliminated. That would be wonderful.
That's right. I
Yeah.
know.
So I mean, we've
It
all,
doesn't always happen that
yeah,
way.
we've all heard about like exercise and proper rest, important for immunity. But how important is it? How much can exercise actually improve your immune system as well as rest?
Well, it's good. I mean, exercise can help flush out bacteria and viruses from your lungs. It also helps to, increase your blood flow and helps to increase and stimulate white blood cell production. So that's a good thing. On the other hand, vigorous exercise too frequently also can be a stressor on your system, and it can actually activate your cortisol production and lower your immune system. And so it is a double-edged sword, exercise. And I think really the point of that is you just have to listen to your body. If you're feeling really tired and you need some sleep, sleep, rest. Don't push it too much, especially during the winter months where these viruses are just getting, to come back, and they're quite severe. And you don't want to overdo it. But exercise in general is extremely good for us.
What about people who suffer from insomnia? I would imagine that that must lower their immune system. Is there any help for that type of condition?
Yeah, so sleep is extremely important because if you're not sleeping, it is actually innately quite a very large stress on your body. And in turn, it will affect your white blood cell production and your cortisol production, and it makes you way more prone to getting ill. And so sleep itself, being as important it is to immune system, is also very difficult for us to treat because there's a lot of different factors that go into why someone might not be sleeping. And unfortunately, there aren't many tests to run to figure it out. Some, like sleep studies, etc., can look at certain issues, but if the issue may be potentially stress related or chemical in nature, decreased melatonin secretion, decreased GABA secretion, yeah, elevated stress, it is kind of a guessing game when it comes to supplementation or treatment for sleep. And so the way that I kind of approach it in my practice is that I will, be very forward and upfront with that with patients, but also there's and then we just usually try different methods, try different things based on what we think the cause is. Do we try a very strong passion flower root extract to calm them down, or maybe melatonin if they've been traveling or they're on shift work or something like that. There's a lot of different things that you can try for sleep that will absolutely help the immune system, but it will vary based on the person,
Okay.
completely vary based on the person.
Wow. Okay, so we talked about ozone therapy. There's also IV, different types of IV therapy used to boost immunity. So, some of us have had IV administered in the hospital, but now many natural health clinics are using this IV therapy to help with immunity. So, maybe can you explain how this works?
Yeah, I mean, it's nothing magical, but what it is we're basically just we're bypassing a couple systems. The first system would be the digestive tract. Now, a lot of people come to us also with digestive issues, so maybe they're not absorbing or assimilating things as well as they could be. And and then beyond absorption, it also bypasses what we call the first pass of the liver. So usually when you take something orally, it goes through your digestive tract and you absorb it. Then it goes into your bloodstream and then to your liver first. And your liver sorts through everything and excretes most of it if it thinks it's excessive. So when we're trying to treat something where you're ill or sick and you're trying to take extra vitamin C or maybe extra B vitamins to help to boost your energy and help to fight against the virus, your body doesn't always absorb what you think you're taking. And so an IV of these things, intravenous, goes directly into your bloodstream and it goes directly to all the cells in your body. And you absorb 100% of those things. So we can dose things quite a lot higher and ensure that there's no absorption issues either. And so it tends to be quite a significantly stronger therapy when it comes to treatment compared to just oral supplements alone. Most patients have already tried a lot of oral supplements by the time they come to see naturopathic doctors, and they're kind of wondering why it's not working. And a lot of times intravenous can kind of get them over the hump and get them back in shape faster.
That's really fascinating. What kind of success rate do you have with patients who have had this IV therapy?
Extremely high. It's We do it when it's indicated, and in my practice, especially, I really love testing to make sure we're not missing anything. So I do, medically accredited labs here privately, just so that we test things in depth. When it's indicated, we do IVs, and it's certainly not indicated in everybody, but when it is, we do them, and the success rate is very high because how we kind of prep before we consider doing the IVs.
You'd mentioned that a lot of patients have those absorption issues. How would a patient know that this is an issue that they're having? Or is this kind of like
An
the
absorption issue.
last draw? Yeah, yeah.
Well, absorption issues really often go hand in hand with gastrointestinal issues or digestive tract issues. So Not always. I mean, some patients may be losing hair or have brittle nails, or maybe they're fatigued, and they don't know why. Just because perhaps they're very used to their digestive issues, they don't really know. But usually, when people, are kind of coming in, they know that something's wrong. In which case, then we can check and we can test things very thoroughly based on the area of the digestive tract that they're coming in with symptoms, whether it be stomach, whether it be small intestine, or whether it be large intestine. There's fantastic tests to figure out, is it an issue and where is the issue? And then also we know exactly how to treat it.
That is just absolutely fascinating, and I could talk at length about this with you, but it looks like we are getting close to being out of time. So thanks so much for being with us today.
Thank you for having me.
Absolutely. Dr. Clayton Koganow is a naturopathic doctor in Lethbridge with Well Vitality Health Clinic. I'm Jeanette Roche on behalf of all of us here at Bridge City News. Thanks so much for watching.